Doctor, you mentioned on direct examination the knee replacement? Yes, I did. And was it partial or total? It was a total knee replacement. Doctor, do you say that you have a partial uncompartmented knee replacement involved here? Yes, it was involving the end of just one bone, the tibia or fibia or femur, or a total knee replacement in which the ends of both bones and often the patella are renewed. Doctor, total knee replacement is by far the most common, is it not? Yes, it is. And does it account for over 90% of cases? Yes, it does. Is it the artificial joint that is inserted? Yes, it is known as a prosthesis. And is the plural prostheses? Yes, the plural is prostheses. Doctor, for a total knee replacement, the prosthesis consists of two polished metal alloy components, usually based on titanium, yes, or cobalt chromium, which replaces the ends of the long bones. Is that correct? Yes, it is correct. And a high-density plastic liner. Is that called polyethylene? Yes, polyethylene. Which sits on the tibia to separate the two? That is correct. Sometimes the back of the patella is also resurfaced with plastic. Doctor, most prostheses are held in place with a bone cement. Is that correct? Yes, such as polymethyl methacrylate, which dries quickly. And some prostheses, doctor, are cementless? Yes, and specially textured or coated to encourage new bone to grow in and secure them. Doctor, what about screws? Yes, screws or pegs are used to stabilize them. Until when? Until the bone growth occurs. Doctor, these require what? They require a longer healing time than cemented joints. Doctor, sometimes a hybrid technique is used, is that correct? Yes, in which the femoral component is inserted without cement, but the tibial and patellar components are cemented in. Once the patient, doctor, is asleep, the anesthesiologist injects a muscle relaxant drug, is that correct? Yes. Why? In order to reduce tension. Of what? Tension in the leg muscles. And doctor, a tight tourniquet is applied, is it not? Only to the thigh to stop blood flowing to the leg. Doctor, the surgeon makes an incision down the front of the knee. Is that correct? That is from 8 inches to 12 inches or 20 centimeters to 30 centimeters long. What does it depend on? It depends on whether you are having a partial or total knee replacement. Doctor, the incision may be made with the knee straight or flexed. Is that correct? Yes. What does it depend on? It depends on surgery, that is, the surgeon's preference. The quadriceps muscle may be encouraged to allow the kneecap to be turned over or pulled to one side to expose the knee joint. And doctor, the joint capsule is then opened, is it not? Yes, it is called an arthrotomy. An arthrotomy? An arthrotomy. Doctor, the surgical team wears full protective clothing, does it not? Yes, it does. Why? To avoid contact with the bone fragments thrown up by the new jigsaw. The saw is cooled using constant irrigation. If it is allowed to heat bone above 113 degrees Fahrenheit for more than 1 minute, long-term bone damage can occur, and we try to avoid that. Doctor, with the knee flexed to 90 degrees, retractors are used to hold back and protect the soft tissues and the kneecap. Is that correct? Well, the damaged lower surface of the femur is removed with a special electric saw and shaped using a special cutting guide. And that is to do what? It is to fit the new artificial femoral component. Using a template, holes are drilled up into the lower end of the cut femur to locate the new prosthesis. Doctor, the damaged surface of the tibia is removed, is it not? Yes, it is removed and shaped to fit the new artificial tibial component. A hole is drilled down into the top of the prepared tibia to accept a peg on the base plate. Some components require the tibia to be shaped to accept a longer stem. The sort of stuff where you make a shadow, you won't read it.